Buckley here, MilfordMD. Fancy Friday. So our patient had some kind of cyst removed years ago, and the result of that was some scar tissue. It was kind of white, and the wound that was put together at that time separated out, and it's a little bit raised, a little gnarly, and she would like something done about that. So what we're going to do is take that old scar out and throw it away. You know, sometimes if scars are a little widened and maybe they're just red, we can laser them and get the red out. But if there are irregularities in the surface, you know, it's up and down, maybe better a lot of times just to cut it out and make a new scar. And there are all kinds of techniques to make things stay together and look nice. If you look at what's marked here, it looks a little funny. It's kind of got little notches in it. If you look at, like, say, two of the notches together, you might say that looks like an M. So it's also called M-plasty. If you look at the M upside down, it looks like a W. So it's also known as a W-plasty. And it comes under a category of closures, which is obviously in this case an excision, then a closure, of geometric closures. So we draw some kind of geometric thing other than the standard ellipse, and then we put that back together again. My numbers are a little smeared right here, but this little notch labeled 2 goes in between this little point here labeled number 1 and 3, and I have 1 through 13 there and 2 through 12 there. So I have to kind of craft these notches so that they all integrate or intercalcate together. We're live. We'll call you back. So that they intercalcate. And then, you know, if you just cut something out and you have tissues underneath that are holding the skin, and you put that together, kind of needs to go together under some tension because the bottommost tissue is preventing the skin from sliding very nicely together. So you really almost all the time want to do some kind of undermining. So even though I'm going to cut this scar out here, I'm going to undermine, meaning make a little shelf underneath the skin over a longer distance, so that then the top part of the skin can slide, let's say, effortlessly and without any tension, so that it comes together in the center. I'll put all kinds of fancy dissolving stitches underneath using different techniques. And so we're trading out a scar that we don't like for one that's going to be different in the crafting, different in the execution, and hopefully will be nice and much more acceptable in the end. Anyway, that's my experience with how these geometric things go. We do excisions and geometric closures, and then everybody's happy with the result. Yeah. So I'm going to get on with it. I'm going to cut this out in a zigzag fashion, undermine the edges, and start to bring those edges together very, very, very carefully. I use different kinds of headgear, magnification, depending upon what I'm up to and my mood a little bit. Sometimes you'll see I'm in fancy surgical goggles with a light on them. We do have a surgical light here. It's off to the side because otherwise it washes out the video and you can't see. I like these because they have a wider field of vision. I usually use 3 diopters, which is about 1.75 on magnification. I'm using actually 5 diopters today, which is about more like 3 on the magnification, so I can see fine little details. It means I need to be a little closer to it, otherwise, you know, here it's out of focus. So probably more information than you wanted, but I thought you might like to get a peek into what we're up to. Fun Friday. Maybe I'll show you how it looks when it's all back together again. Thank you for watching.